I'm Christy Ogfeld, co-founder of the Brain Inflammation Collaborative, and I'm so excited to be here today as we kick off our webinar series. We look forward to sharing new research, new discoveries, new treatments, and hopefully a chance for others to learn more about brain inflammation, also known as neuroinflammation. Brain inflammation as a result of an infection, allergies, autoimmune disease, or even an injury can trigger symptoms in some people, such as severe fatigue, depression, anxiety, insomnia, brain fog, nerve and joint pain, and dizziness or lightheadedness, among many others. These symptoms can be misleading due to a lack of clear diagnostic methods and established standards of care. So we created a research platform that integrates multiple data sources, including patient-reported data, health tracking wearables, validated survey instruments, and symptom tracker information, as well as the much-needed ability to connect patients with clinical studies and to provide tools and resources for researchers. We look to uncover connections between seemingly unrelated symptoms and diagnoses and to advance patient-centered research. Our hope is to reach more patients, support more communities, and push forward progress toward long overdue answers. Our approach complements the work of advocacy groups by fostering a collective research framework that spans 30+ related diagnoses. Through our digital health platform, patients from diverse backgrounds can contribute valuable data, allowing for large-scale cross-disease comparisons that traditional studies often lack. We look to reduce barriers to research and the discovery of treatments for those impacted by these infection and inflammation-driven illnesses. By sharing knowledge and building on existing work, it transforms research into real solutions, faster diagnoses, better treatments, and improved outcomes for patients. Today, we have an amazing opportunity to hear from 3 great speakers who will give us insights into increasing brain blood flow, a personal patient experience, and how to use our research platform. First, we'll hear about a device created by Alex Stenzler, the Hi-OxSR sequential rebreather that can help increase the flow of oxygen to the brain. Recent research has shown that people with even mild COVID had a greater decline in executive function and their ability to perform complex tasks. The Hi-Ox is an FDA-cleared device and has been sold in the US for 20 years, and thousands have been treated using this device with its original intent to provide high-flow oxygen needs in a home setting. Now it's being tested for those experiencing brain fog. He's going to be discussing the science and mechanisms behind COVID-related cognitive dysfunction and how the rebreather device works. Second, we'll hear from Tom Morse, a long COVID patient who will share his experience using the rebreather. And finally, our very own Dr. Megan Fitzgerald of the Brain Inflammation Collaborative will talk about our research platform, Unhide, how it works, and how to leverage it to track the effects of medical interventions. So now I'd like to introduce our first speaker, Alex Stenzler. Alex Stenzler is the president of 12th Man Technologies, an R&D corporation, and also the chief science officer for Monitored Therapeutics, a telehealthcare company. His background is in pulmonary and critical care medicine and infectious diseases. As a non-physician, he has been working in the field of pulmonary function testing since 1968. He has spent half of his career managing respiratory care departments, COPD clinics, and pulmonary function laboratories, or teaching pulmonary function technology as an assistant professor at the State University of New York at Stony Brook, and 12 years at the Graduate School of Adelphi University. He has been the PI for 2 NIH and 1 DARPA grant, and has extensive research experience, including more than 30 years of research and development in the healthcare industry. More than 20 years ago, he worked on technology to control cerebral blood flow as a diagnostic technique, which work he currently has transitioned for the treatment of long COVID. He has developed technology for protecting healthcare workers from viruses going back to 2003, and has designed unique N95 masks for respiratory system protection. He has co-authored 24 peer-reviewed papers and 1 book chapter on pulmonary function testing. And with all of that, and that was a lot, I'd like to introduce Alex Stenzler.
Christy, thanks very much for the introduction. Really appreciate everyone being here today. Let me bring up my slide deck here. Um, this one. Can everyone see that and hear me?
Yes.
All right, good. All right, thanks, Ben. So today I'm going to talk about the treatment of long COVID-associated cognitive dysfunction with the Hi-OxSR sequential rebreather. And this is an important an important need. Remember, we have at least 17 million people with identified long COVID in the United States. But beyond that, if we look at the data out of the UK Biobank, it probably affects a much greater number of people that don't really know that they have long COVID. As you might just say, well, I'm forgetting someone might say, I'm just forgetting things, I'm just getting old. But in many cases, it's actually the effect of long COVID and its effect on cognitive function. If I get to the slide. Here we go. Sorry. So when we look at the effect of cerebral blood flow of COVID, we know that COVID is an inflammatory disease. So it tends to inflame the vessels. And when you inflame vessels, they get narrow. If you think of this in the concept of fluid dynamics in a pipe, for example, if you take a pipe and you reduce its diameter by just a half, it doesn't reduce blood flow. It doesn't reduce flow through the pipe by a half. It increases resistance 16-fold by just a halving of the diameter. So that means that if you have the same blood pressure driving blood to your brain and the vessel drops in half, you get 1/16 the flow going through the blood vessel to the brain. So it's really easy to understand how even mild inflammation of the cerebral vascular bed can starve the brain cells of oxygen and other nutrients. As Chrissy said, we originally developed the Hi-OxSR. This was done over 20 years ago, actually about 2000, 2001. We were looking at controlling cerebral blood flow as a diagnostic test. We would turn the CO2 up and have them come back down and turn up again every few minutes to see what would happen to cerebral blood flow. We were looking at vascular reactivity. That's how the blood vessels in the brain and actually the optic artery responded to CO2. If you look at the graph on the right, you can see these circles represent the CO2 values as we go up and down. Here's the timeline. And if you look at cerebral blood flow, the solid line, you can see that the cerebral blood flow tracks the CO2 almost immediately. It's a very fast response, meaning that if you can increase CO2, literally within a few seconds, 10, 15 seconds, the cerebral blood flow will follow and increase as well. All right, so if you look at these, again, if you look at the now, you have a bigger scene. You see these dots are the CO2, the circles of the CO2. And as soon as the CO2 went up, so does the cerebral blood flow. So this goes up and down as we tracked it. And because of that, when I realized that CO2 that reduced cerebral blood flow was associated with change in cognitive function, I thought, well, maybe we just increase the CO2 and hold it up there instead of bringing it up and down to see if had a change. And what it is, we found that we did a feasibility study here in California with 5 subjects to see if these were friends of mine, had prescriptions for it, to see if it fixed their or reduced their brain fog. And all 5 patients, all 5 subjects improved. Based upon that signal, we then did another pilot study in Canada. This was done with 36 patients that have long COVID. This was done by the physician who runs long COVID recovery for all of Canada. And this was again, open label, so everybody got the Hi-Ox. It was not a control arm. And they did seven brain executive function tests and 1 quality of life test. Because this graphs are pretty small, I'm only showing you 2 of them. The gold lines are the patients that actually improved. So we did them at baseline. We did them at day 15. So they were treated for 2 weeks. And then we brought them back 30 days later to see if they maintained their improvement. And the gold lines are the individual patients that improved during the therapy. And the blue lines are the ones that did not improve or had no change. And you can see about 75% to 80% of the people, depending upon the test, have a positive response to the rebreathing treatment. And you can see also that even after the treatment was stopped, A month later, most of them had improved. I should point out that the 5 people that we treated now almost 3 years ago have all maintained their improvement. Doesn't happen in all cases, but this is those it did. To give you an idea to understand these numbers, for these two executive function tests, an increasing number is an improvement. So you can see that this is going up, they get better. On the brain fog questionnaire, a quality of life, you can see that, interesting enough, a couple of patients, and I'll explain, you'll understand why, by the end of the treatment, some of the patients actually felt worse. But you notice 30 days later, after they stopped, there was a significant decrease in the abnormality of quality of life, meaning the quality of life improved dramatically for these people in the following 30 days after stopping the treatment.
Alex, I'm not seeing your slide.
Megan, do you see Christy or Megan, do you see the slides?
Yes, I see everything, yeah.
Okay.
All right. And Christy, you see it as well?
Yes.
All right. So the question is, why does CO2 improve cognition? And you'll appreciate the slide in many of the things that we'll talk about or that you can think about. CO2, most people don't realize, has a very significant impact on cerebral blood flow. So this is a graph of intracranial cerebral blood flow, and this is the carbon dioxide level in the blood. In a normal person, your carbon dioxide level sits around here. If you increase your CO2, which is what we're doing in this treatment, we get to about somewhere in this range here. You can see that the CO2 has a dramatic increase. It can increase 20 to 60% from baseline. Conversely, if you hyperventilate and blow carbon dioxide down, which is seen in some patients with long COVID, and we'll talk about that, your cerebral blood flow actually goes down. So there are certain aspects of long COVID that are actually independent of inflammation in the brain will actually cause brain fog and loss of executive function because they cause you to get rid of CO2, blow off CO2. Now, the interesting thing about CO2, it's an interesting molecule besides having this unique relationship to cerebral blood flow, is it has also anti-inflammatory properties. So it has the potential to reset the neurons in the brain. So some of this autoimmune response might be quelled by the CO2 itself. Additionally, CO2 has been shown to upregulate serotonin in the brain. So we know from the serotonin in the gut is reduced in many patients with long COVID, which actually affects the cerebral function. Having the CO2 upregulate serotonin may also be a beneficial effect of the rebreathing CO2. So how does this work? So the Hi-OxSR rebreathing mask is a unique mask because it allows you to increase your CO2 without using an external CO2 tank. In order to do that, you'll see we have a mask here that's a tight fitting to the mask. There are 2 head straps, so it keeps a tight seal. There's foam along the top bridge, so it creates as much a seal as possible. And there are no holes in the mask. Most oxygen masks have holes in the mask to prevent asphyxia because of if the oxygen runs out, you need another pathway to get air in. But it also dilutes all the oxygen you breathe in. So there are no holes. So all the breathing gas comes from these circuits down here. There's an exhalation valve in here that allows when you exhale to blow out air down into your exhale breath into the rebreathing tube, and I'll talk about that in a minute. This is the oxygen reservoir there where the oxygen flows in that you breathe in, only 2 liters per minute. I'll talk about that. This is where the oxygen connects to the device. And over here is the sequential rebreathing valve. And that valve is closed during exhalation, but when you breathe in, once the oxygen reservoir bag is collapsed, this opens up and allows you to breathe in the CO2 that was in your last exhaled breath. So let me show you how it happens on each breath. When you breathe out, this red line, this red arrow, shows the exhaled air leaves your mask, and goes down this rebreathing tube. Now, this tube is a long tube. It's at least 6 feet long. And the reason is we have to keep your exhaled breath in a linear relationship so that the air closest to the valve when you breathe in is the last gas out of your alveoli, which is high in CO2. The oxygen from the oxygen concentrator comes in here, fills the reservoir bag, just a little. You'll see very little movement because it's only 200 liters per minute, and puts pressure on the sequential dilution valve to keep it closed. All right. So at the end of your exhalation, this tube here, the rebreathing tube, is filled with air that's high in carbon dioxide from the alveolus and still high in oxygen. When you start to breathe in, the first day you breathe in is basically all oxygen from the reservoir bag plus the continuous flow from the oxygen concentrator. Now, those only flowing at 2 liters per minute. Your body only needs approximately 0.35 liters per minute for your oxygen consumption, meaning that even though it's only 2 liters per minute, because of the concentration, we're providing 6 times more oxygen than your body needs at rest. As you continue to breathe in, once you've inhaled whatever oxygen is in this reservoir bag, it collapses. And then the sequential dilution valve opens, and you inhale the CO2 and oxygen that was in the rebreathing tube, and that goes into your alveolus. The CO2 level in your air sacs go up, and therefore you have more CO2 that goes into your blood, and it raises the CO2 being delivered to the brain. It's a relatively easy thing to do, but it's not necessarily the most comfortable thing. So besides the Hi-Ox rebreather, we have one of our friends that was actually using the treatment, and you can see how long the rebreathing tube is. You need an oxygen concentrator, and the oxygen concentrator needs to be one that's a continuous flow, somewhere between 2 and 5 liters per minute. It can't be a pulse delivery system. So some oxygen concentrators, when you start to breathe in, it delivers a pulse of oxygen, a bolus of oxygen, and you breathe in room air. It has to be a continuous flow system. Besides that, you need a pulse oximeter. Now, the pulse oximeter really isn't there because it affects the results. But the problem is that carbon dioxide, besides dilating the blood flow to the brain, also drives ventilation. That's what makes you breathe. It's really not low oxygen. It's really high carbon dioxide that increases your ventilation. So here you can be sitting in a chair thinking that you're running a race because the CO2 is making you breathe deeper and faster. And to reassure you that you're getting enough oxygen, because you don't know for certain, the pulse oximeter will reassure you that you're getting enough oxygen. And in most cases, your oxygen saturation will actually go up during the treatment because your oxygen delivery will be higher. Additionally, it does serve as an alarm function in case this connector down here from the concentrator if it pops off, then you're not getting oxygen to the bag. You may not notice it because it doesn't move very much, and your saturation will fall. So it's really a safety warning. Again, you want to make certain there's no leak around the mask, because if there's a leak around the mask, then you're not going to be rebreathing. Air will take the path of least resistance. So you want to make certain that you have a tight seal. Sitting back and taking pressure off your diaphragm will probably be a little bit more comfortable. We are currently treating patients for 30 minutes twice a day for 28 days. And I'll talk about some other options when we get further down to some of the other slides. All right. So, like every TV commercial for a drug, we have to tell you what the possible side effects are, because nothing comes for free. Here are some of these adverse effects or side effects that people have reported. One, you're increasing cerebral blood flow to the brain. Some people have reported a headache, which usually goes away shortly after stopping. I should point out that CO2 has been reported as a treatment for migraine headaches, although I have not explored that with this device. Asthma is another somewhat concern. Because you're increasing your breathing, it may trigger it's almost like a exercise-induced asthma response for some people. So if you have asthma, it's a good idea to speak to your physician. They may want you to take an inhaled bronchodilator or an oral bronchodilator before taking the treatments in case you have a predisposition to wheezing. Patients with chronic obstructive lung disease may have other breathing limitations and may not respond to CO2. So patients with chronic obstructive pulmonary disease should also speak to their physician before using this. Rarely we've had some people report nausea, And we don't know if that's swallowing air. We don't really have the mechanism, but that also tends to be short-lived and goes away afterwards. Fatigue and PEM, post-exertional malaise, are maybe somewhat related, and we're not really certain, but you're breathing deep and fast for 30 minutes, and people may feel fatigued. And as I pointed out earlier, some patients, the quality of life by the end of the treatment, by the end of the sessions, was not great, but it was worth it when they looked at the benefit 30 days later. We've had two people, who not in that study, but people who have been using this for treatment, who reported a PEM crash, and we don't know if it's the increased activity of the respiratory muscles that caused it. We're still exploring that. We have some studies that we're looking at to try and explain why, and we have some suggestions. We are looking, if you remember from the slide I showed on how fast the brain flow responds to CO2, it may be possible to do multiple treatments like 5 minutes or 10 minutes more times per day to get the same benefit without triggering a PEM crash. And I want to talk a little bit about this is a little something that I want to talk about that I just been digging into about the last maybe 2 or 3 months since we started looking at PEM and post-exertional malaise and other chronic fatigue syndromes, is how that aspect, the metabolic aspect of long COVID, can affect brain fog. And we know that the virus does interfere with mitochondrial function, meaning that the mitochondrial needs oxygen in order to produce the energy, ATP, to do things. And if it interferes with the mitochondria to use the oxygen, and that can come from either direct mitochondrial interference, or there's also evidence of extracellular amyloid deposits interfering with oxygen delivery to the mitochondria, then you develop anoxia. I'm not going to talk about the tachycardia section, but I'm going to talk about all the way on the left, this section here, what happens. What they've demonstrated in patients that have this mitochondrial dysfunction is that patients start to, as you replace type 1 fibers in your muscles, they tend to replace with type 2A fibers, which are glycolytic fibers, meaning these are fibers that normally function more under anaerobic mechanisms. When you're producing energy, the best way to produce energy is by aerobic means the cell gets oxygen, uses a small amount of glycogen to produce the energy you required, and you continue on. If you're running under anaerobic conditions, you're running under glycolysis, which is the anaerobic metabolism, and you actually consume 18 times more glycogen for the same energy unit same ATP unit that you produced under aerobic conditions. If you think about runners that run marathons and they talk about, I need to pace myself so I don't hit the wall. It's because if they don't pace themselves and they run above their anaerobic threshold, they start to consume glycogen 18 times faster and they just run out. It's possible, and this has been demonstrated in long COVID patients, not that they run out, but that the glycogen levels are lower. They do have more glycolytic fibers. This may be one of the components of post-exertional malaise or chronic fatigue syndrome because you're constantly running with low glycogen levels. The other aspect of it is when you're running anaerobically, one of the byproducts of anaerobic metabolism is lactic acid, hydrogen ions, which is the abbreviation for the acid component. The body likes to have the pH in homeostasis, means it wants the pH at 7.4. And in order to do that, the other aspect of the balancing of pH is actually carbon dioxide. So, because carbon dioxide is an acid as well. So the hydrogen ions come into the blood, they're buffered, carried to the lung, and you get rid of CO2, which is the other side of the acid. And if you increase the removal of CO2 to compensate for the hyperventilation, you end up decreasing the PCO2, which we've shown is evident in some patients, not all patients, but many patients with decreased PCO2 with long COVID, decreases cerebral blood flow, and can contribute to brain fog. So this is an area that we're still doing some research in. We have a couple of research programs that we're starting on to look at this left side of this flow chart. But this is really a very interesting component that most people don't make the connection between the lactic acid and brain fog being tied to this decrease in PCO2. I really appreciate your time. I hope I didn't run too far over. If you have any questions, because after this webinar, you can reach me at this email address. You can also find out more detail. We have a more detailed video, a 20-minute video that goes into more detail on this on our long COVID research page. Christy will, I think, is going to send this information out later. And it also includes, we have a page of, it's a newly launched page, so you'll forgive some of the tweaks in it, but there are also about 33 articles that cover all the materials on fiber replacement, acidosis, hyperventilation, the two studies we've done. We have a study starting right now, another study in Canada, which is a prospective placebo-controlled dose-ranging study. So we're still doing research in this space, and we're going to be starting a study on lactic acid fairly soon. Again, thanks very much for your time.
Thank you, Alex. It's just absolutely fascinating to hear about the new developments that you have, and how the rebreather could be something that's less invasive and an exciting way to hopefully help patients improve their symptoms. And I can't wait to hear what questions our attendees have for you. Now I'd like to introduce Tom Morse. Tom Morse is a retired IBM executive consultant who developed long COVID in 2022 and suffered debilitating symptoms, including heavy brain fog, balance issues, and migraines. He found improvement from the increased CO2 and improved blood-brain flow of the rebreather device. Thank you, Tom, for sharing your story with us today.
Sure, thank you. Little different take here. Just my experience in long COVID. I just had COVID, not too severe for 1 week. And then about a week following, in March of 2022, it was almost like I needed to be in a wheelchair. My poor wife, we lived in a darkened room. I would fall. I was very challenged for energy. I would try to take a walk I would normally take and find myself standing on the sidewalk, just rubbing my hand for I was just out of it. I had dyspnea, breathing deeply for air with no apparent cause. And it was, of course, no help to my wife. I had Kaiser Healthcare. My primary sort of dismissed it, saying it'll be better in 6 months. I sought a different primary at the same time who would be more helpful. Kaiser would not treat long COVID because it's simply too new for the HMOs to find funding. I found a RTHM rhythm group that was treating specifically long COVID and PEM, MACSF. So I pursued them avidly, and that's where I met Alex, actually. Kaiser did help on the vision side and neurology. They assembled you call them assembled characteristics of migraine. So they diagnosed with migraine in order to get Botox shots, which are one of the things that have helped as well with light sensitivity in other areas too. They got me into various therapies, physical therapy, occupational therapy, visual versions to help take care of all the visual sides of things. And the new PCP I got with Kaiser is more cooperative, working with other medications I needed to get. Through Rhythm, I did a number of medicinal supplements I'm still on that helped with the energy. Alex spoke of mitochondrial dysfunction. There are a number of pathways for that, apparently, from what I'm learning. ATP generation interruption, also gut inflammation, dysbiosis. One of the treatments, the first ones that Rhythm did with me, was triple anticoagulation therapy. Alex had also mentioned some amyloid proteins. The Rhythm folks found a study in South Africa that actually uncovered a lot of amyloid plaques in my amyloid protein plaques in my blood. So the anticoagulation therapy helped that and gave me sort of my mornings back. At the same time, my Rhythm doctor, Dr. Malcolm, um, hooked up with Alex, I think in the Canadian study, and talked about the rebreather. I'll get to that in a second because that was significant. Then we looked at cerebral spinal flow issues for me. So as many of you who have had long COVID have probably experienced, There is no one single answer, but I put the CO2 rebreather experience way up there and all these things I just mentioned. Again, it was, as I say, it was initiated from rhythm. Dr. Malcolm found Alex's study, the rebreather and the oxygen oxygen concentrator came up, and I started the treatment. About the treatment, if anyone is looking at it, it looks a little scary initially. Alex mentioned that, but relax. I have the advantage of being a singer, and I skin dive, so my lungs are. I'm used to deep breathing. Also, the dyspnea itself causes me to gasp without necessarily any cause. As I hooked it up, you do feel like you're not getting enough air. As Alex also mentioned, the pulse oximeter on my finger definitely showed high oxygen. And after initially trying to get a little more air, I just relaxed into it and just breathed deeply, which encourages. And the second and third treatments were easier. And by the time a week had passed, I literally almost looked forward to it. It became meditative. And I also started noticing more clarity. Hard to describe. Those of you who know brain fog know that it's not, the words brain fog don't really quite describe it. Your world changes in. You're in a limited space. The world seems buzzy and fuzzy. It's almost like you have mental as well as visual blinders on. The CO2 rebreathing helped open that world up. Also, the thinking became clearer. And so I asked Alex, and I'm sure there'll be questions about this too, that, gosh, this has helped. How about we continue beyond the 28 days, but not at this point in time. So the benefit seems to be lasting. So again, as it was coming to an end, I was almost sorry for it, and I was afraid that it would go away. But the increased clarity of the world and thinking does continue. My overall impressions are, well, the very next month, I made a trip I could not have made without the rebreather to help my brother, schizophrenic with colon cancer, Torrance, California. I'm in Portland, Oregon. I would not have been able to make that solo trip by myself without having the confidence of the rebreather stamina, helping around the house. And when I started with long COVID, before then, I had been exercising, doing well. I felt like I was 10 years younger than my early 70s. Long COVID had me feel like I was definitely 10 years older. The rebreather and a few other therapies have brought me back to hopefully feeling about my own age, by now about to be 75. Of all the therapies, again, the rebreather is certainly at least 1/3 of, I think, what has lifted my whole view. So where I am right now, I'm able to start our retirement journey that I'd almost given up on with long COVID, being able to take trips. We just bought a trailer and a truck, so I really thank you, Alex, for coming into my life. I still have questions about maybe continuing the rebreather, but I guess that's it from here. Thanks. It was a very good experience for me. It's hard the first few days, relax into it. Thank you.
Thanks, Tom. That's an amazing story. And, I get goosebumps actually hearing things like that. And we're very appreciative of your time and your insights. And I'm sure that some of the attendees will have questions for you. But I love the idea of hearing that it becomes meditative and that you are able to actually enjoy it. And sometimes knowing that something is going to be hard, but it does get easier or better. It's just really important to hear that. So the people can ask questions at the end, of course. And now it's my pleasure to introduce Dr. Megan Fitzgerald. She's a neuroscientist with a PhD from Weill Cornell Medical College, where she specialized in adolescent neuroanatomy and cannabinoid receptors before shifting to neural stem cell research during postdoctoral work at Mount Sinai and Columbia University. At Columbia, she investigated the neurobiology of suicide and regenerative medicine, earning Young Investigator Awards from NARSAD and the American Foundation for Suicide Prevention. After developing long COVID in 2020, she pivoted her focus to patient-led research, joining the Patient-Led Research Collaborative to study the long-term impacts of COVID-19. There, she co-led a major survey on reinfection, brought patient insights into scientific research, and served in leadership. Now, with the Brain Inflammation Collaborative, she explores the role of neuroinflammation in cognitive and mood symptoms, bridging gaps between patients, scientists, and clinicians. And we are really happy to have her as part of our team. So she's going to be describing how to leverage our platform.
Thank you so much, Christy. Let me just share my screen. Give me a moment and bear with me. I want to thank everybody for joining today and sticking with us through some of the technical difficulties we had in the beginning. I am aware Mercury is in retrograde right now. As a scientist, I don't necessarily believe in that, but at the same time, I'm more than happy to blame it for any issues that we have with Zoom. So that said, can everybody currently see my screen?
Yes.
Yes.
And it's not in presenter view. We're good.
It's not, it's in the right mode.
All right, perfect. Thank you so much. Right, so I'll get started. I want to say thank you, Alex. Thank you, Tom, for sharing your stories. What I'm going to be talking about is how Unhide, which is a digital health platform that the Brain Inflammation Collaborative is developing, can be used to better explore and describe the effects of different treatments and therapies, like the rebreather device that Alex had described and that Tom had used. So what is Unhide? Unhide is an online health platform that is accessible via an app that you can download or via the web that can be used to track symptoms. You can connect wearable devices. These would bring your own wearable devices. So if you have something like an Oura Ring, a Fitbit, Garmin, anything like that can be connected to it. It will help you as a patient download symptom data reports, complete surveys. You can even set pacing notifications, which is really important for those of us who have symptoms of ME and experience post-exertional malaise, because this can help us to better pace and control our symptoms. And it can help patients identify patterns in their health over time. In addition, this app can help people connect with researchers and participate directly in research studies. As I mentioned, this is now run by our nonprofit, the Brain Inflammation Collaborative, and My Data Helps is the name of the group that helped us to generate this platform. This was formerly known as Solve Together. So if you had enrolled in Solve Together, which was developed by Solve ME, this is the same platform. You don't have to do anything to re-enroll. It's completely free for participants. And it's important to notice, in contrast to a lot of for-profit corporations, because we're a nonprofit, your data will never be sold. It will never be used for advertising purposes. And how is this platform used? We can unlock insights with Unhide to track treatments and symptoms in complex health conditions. There are a lot of unmet healthcare needs in conditions like long COVID and ME. And, despite so many years with ME and 5 years now with long COVID, there are still no FDA-approved treatments for these conditions as well as some others. This can lead to a trial and error pattern for patients and their care providers, because they don't know what's going to work or what's going to work with one group of patients versus another group of patients. So you try one thing, it might actually make someone worse, and then you move on to the next therapy. But Unhide can help to provide some real-time feedback on symptoms and treatments to help users recognize patterns in their health and kind of, shorten that path of trial and error and make things a little bit easier to see and to track in a more systemic way for patients and their care providers. So how can using a digital health tracking platform benefit patients and researchers? I mentioned some of the ways with patients, but also you'll be able to visualize timelines, including symptom graphs, and you can share that with care providers using the platform. And in this way, it can support individualized, evidence-informed treatment plans. A lot of our complex conditions are often relapsing remitting, and what this means is that you can have a period of really ill health followed by a period of quite decent health. And this can lead to difficulties in both identifying triggers and treatments. And Unhide and these digital health platforms can really help with that. And this can help overcome challenges of relying on memory or on paper logs of symptoms. And it's also a free and secure platform for patients. Now, on the research side, this can help researchers recruit patients for clinical trials. And at the same time, it can consolidate symptom and treatment data alongside the information that I mentioned that would be collected from wearable devices, the demographic information, some basic questions that we ask of everyone in the platform. As Christy had mentioned earlier, there are also validated survey instruments that are embedded into this research platform. This is important because these are the same survey instruments that are often used as endpoints in clinical trials by pharmaceutical groups, research groups, and academic institutions. Researchers can also add custom questionnaires to the platform that can be presented to patients. This allows patient-friendly data collection on the longitudinal natural history of these complex chronic conditions. And what that means is that this is real-world data. This isn't, a lab rat sort of situation. This is something that is happening in real time, in the real world, with the triggers and the stressors that all of us can experience. So essentially the goal of Unhide is to support patients in real time today while simultaneously allowing researchers to help develop tomorrow's treatments. So that's the why of using a digital health platform like Unhide. And over the next few slides, I'm going to walk us through the how of how patients can get started with Unhide, how this can be used, for instance, with treatments such as the rebreather. So, for more details regarding enrolling in Unhide, please visit the webpage of the Brain Inflammation Collaborative. And once you sign up for the platform, this is what the home screen will look like. This is how it would appear on a web browser. It'll look a bit different if you're on your phone. And you can also use your phone and tablet. So from your home page, you can begin symptom logging here. And each symptom that you can choose, and today the two that I'm going to go through are fatigue and brain fog, because these are commonly experienced by people with most of the complex chronic conditions that enroll in Unhide. And what you can do, you can choose what color you want this to appear as. And you can also choose the severity as shown here. You can use mild, moderate, severe rating or a 1 to 10 point rating. And you can choose this individually for each symptom that you're going to be tracking. In addition to that, you can add your own symptoms. So there's a custom list, there's a list that we have that shows up for everyone. And you can add symptoms that you might experience, like I'm putting in headaches here. And then I'll also add in migraines. And once you add these in to the platform, you can once again pick how you want to rate them on a severity scale, choose whatever color you want to represent whatever symptom that you're tracking. And even for your custom symptoms, this will allow you to really kind of make this app really unique in terms of your own health challenges. And then we'll go up to treatments here. Now, I'll type in the rebreather here because that's what we're talking about today. What I will say is that you can't, within the app, show what time of day you're using the treatment. So here I'm typing in the AM and the PM, which was the treatment paradigm that Alex had described. Now, I think we know in the real world, you're not always fully compliant, even though we do our best. So in this way, you'll be able to track, did I do this once a day? Did I do this twice a day? Was it the morning, the evening? So that's how I would recommend going through if you want to track the timing of your treatments. Once you do that, you will be set, you can set a daily reminder. And I would recommend doing it at some point in the evening so that you have, you can have the full day's worth of symptoms rather than in the morning when you're not sure what's going to happen that day. And you don't need to choose a reminder. That's fully optional. Now, once you've set the symptoms and the treatments that you want to track, you can log the symptoms. You'd go in here and you can choose what symptoms that you experience on a day, and then you can select what severity level that you had for those treatments that you have severity level for. And then you can also select the treatments you performed and then your overall feeling for the day. You can also add any additional notes that you might want to add for the day. For instance, if there was a specific trigger or an event that you had experienced that day that you might want to keep a record of. Going on to this next slide. There we go. I'm going to walk through how tracking treatments and symptoms over time will look like using the calendar view. So the idea here is so that patients and participants who are using the app can get a feel for how different symptoms might evolve over time and might be influenced by different therapies or treatments that they're doing at that point of time. So starting at the home screen again, you can go over to the calendar view and you click on that. And for this, you see August. We're still at the beginning of August, so there's only a couple of days that were tracked here. And you can see the symptoms that were experienced. And on the circle, the pie charts, you can see which symptoms, and I've switched now to July, so you can see the full month worth of data. And you can see which symptoms by these color-coded choices that you chose earlier were experienced on different days. And you can click on each of these symptoms down below, and you can see what symptom severity you experienced on which days, and your average symptom severity for the period of time that you're looking at. And you can do this for each of your different symptoms that you're tracking. So there was difficulty sleeping here, there was brain fog with the last one. And you can flip month to month to see how things are going. Underneath, you can track your daily overall experience. And then up here, you can see on the top of each of these little pie charts what treatments you use, just toggling these on and off. So you can see on these days where the rebreather was tracked. The 2 dots mean that both the AM and the PM treatments were logged for those days. Now, if you did the notes, you can see here was a note, poor air quality day due to wildfires. And you can look at that and you can see if that's triggering any different symptom flares. Now, finally, what's really neat about this is that you can also download and export this data in a PDF form. And this is something that you can bring with you to a doctor's appointment, for instance, or you could have for your own personal use. On the top here, we have all of the different symptoms that were being tracked in this mock user. And you can see here the dates when the rebreather started and it was tracked AM and PM, the overall daily experience below that, that you can see corresponds to which days of treatment, and then the average symptom scores as you continue to scroll down. And this is all of the different symptoms that I had opted to track in this demonstration. And I do want to reiterate that this is a demonstration. This is absolutely not any real patient data here. Now, finally, as powerful as the symptom tracking and medication tracking tools are in the platform, we know it's not the complete story. And for this reason, our team would love to hear more from you about different treatments you might have tried to help manage your condition and how this worked for you or didn't work. So we developed a new survey called What Helped, What Didn't. And this will allow you to share your experience about treatments, therapies, diets, supplements, and interventions with researchers in the community. This survey will be launched on August 25th. So later this month, and this will again show up on the homepage under surveys that you can click on. And we'd invite any of you to share your story about treatments that have helped you, those that haven't worked, about side effects and more. Some of the questions we asked are, treatments that may have had to be discontinued because of side effects, ones that helped initially, but then stopped working, and treatments that did not help or even made the condition worse. So we would certainly appreciate you sharing this with researchers, and and in this way, this real patient-sourced and patient-friendly research can really be used to benefit the whole community and allow you to tell your whole story. So just to summarize what I've spoken about today, tracking these real-time outcomes using this digital health platform that we're launching called Unhide can help improve care, and it can also foster innovation in complex chronic conditions like the work that Alex is doing with the rebreather device. Our patient dashboard provides rapid feedback to help patients and care providers to guide medical decisions about treatment, and it can also help researchers understand how to better target different therapies in different populations. So this is a link to enroll, and I believe that this is going to be displayed as well during the Q&A session. One thing that I do want to emphasize, if anyone who is listening today is healthy and is sitting there, well, oh, this sounds nice for people with chronic illness, but yeah, too bad I can't enroll. You can. We are always looking for healthy populations as well, like healthy controls. And healthy people really do play a very important role in any sort of biomedical research, and this is really something that you can do positively and proactively to help support the people you care about who might be struggling with these conditions. Right now, sign up is open for adults, and I'm really excited. We are expanding this platform for pediatric use in children and teenagers soon, and we're also going to be launching this platform in Spanish very soon.
Thanks, Megan. That was great. Taylor is going to do some housekeeping. She's on mute, but I just wanted to say thanks, Megan, and Taylor's going to take it from here.
Hi, everyone. Thank you so much for being here. Can everyone hear me okay and see my screen?
Yes.
Thank you all so much for your patience today. Thank you for your grace today. This is our first webinar as an organization, and many of you are seasoned professionals. And so to you, I say, I commend you because this is not easy. So thank you to our panelists. Thank you to all the people behind the scenes who are helping make this happen. And thank you to whatever fairy made the audio in my computer suddenly start to work. So just circling back on a few things that were intended to be towards the beginning, but are now going to be towards the end. The webinar recording will be shared with all of the folks who have registered. We'll also answer additional questions. I know we're getting really close to time, so if you've got to drop off, totally understandable, but we will get a few questions answered by our panelists right now. And we will also answer a few more in our newsletter, which hopefully you all are signed up for. If you selected like, yes, I'd like updates, perfect. We'll get more of those questions answered for you in the coming weeks. So reminder to keep putting questions down there in the Q&A. If we don't get to them, we'll do our best to answer them after the fact. We'll also be sending you a survey so that you can let us know all the things that we can do better next time. I already filled out a couple myself, so we're just gonna, continue soldiering on. So with that, we are gonna move into our Q&A session. And while we kind of go through questions with our lovely guest speakers, I am going to leave this slide up on the screen so that you have a little bit more time with it. I don't want anyone to feel like, oh, darn it, I need to go back and pause or anything like that. So I'm going to leave this up and I'm going to turn my screen over to the questions. And I will start with a question for Megan. What treatments have shown promise for treating brain inflammation, and does the gut microbiome cause that?
So the treatment that has probably the most evidence that it directly reduces brain inflammation in terms of reducing microglial reactivity is low-dose naltrexone, which is also known as LDN. But that doesn't necessarily mean that other treatments don't reduce brain inflammation, not by a long shot. It's something that needs to be better investigated. There are certainly a number of immunomodulators that also have been shown to decrease glial reactivity in the brain. In terms of the gut-brain connection, absolutely. There is a lot of evidence that an aberrant or diseased microbiome can lead to increased inflammation, neuroinflammation. And in fact, there has been a clinical trial showing that a specific strain of probiotics can be quite useful in treating symptoms of neuroinflammation in long COVID. And we do hope to get, more information on how this can different treatments and how they impact symptoms of neuroinflammation like brain fog, fatigue, headaches, migraines, so many of the things that so many of us with these overlapping conditions experience. We hope to collect that data through Unhide.
Alex, this question's for you. Why is the rebreather treatment a one-time thing? Is there a permanent change it brings about, or is there a negative to follow-up treatments?
So when we did the first series of subjects, the feasibility study and actually the Canadian pilot trial, it was for 2 weeks. Two of the people in the feasibility study, again, it was only 5 subjects, they came back and said, we feel so much better, but we think we can get even further improvement. And they did it for another 2 weeks, and they both got a second kick in improvement. And that's why the study we're doing now, this prospective trial in Canada, is 2 weeks of Hi-Ox, 2 weeks of non-rebreathing, just oxygen, and 4 weeks of the Hi-Ox to see if there's a continued effect. Because of the response, and also some of the patients in the Canadian study also said that they would like to get a further extended treatment, but that study didn't allow for it. But because we saw this small effect, or a small number of people had an effect with extended use, we basically set the standard treatment now is 28 days, 4 weeks. We have had some patients, so the response has been varied. I said we still get about 75 to 80% people have a positive response during the 4 weeks. Some people don't. Part of the situation here is that we basically just send equipment to people's homes, and there's nobody physically there to supervise, are they getting a tight enough seal, are they actually rebreathing, things like that. So it's somewhat uncertain, or it could be physiologic differences why some patients don't respond. If the CO2 happens to reset the neurons in the brain and maintain cerebral blood flow long enough, then it might settle down the brain and the cerebral blood flow, and you'll maintain that level of improvement. Some patients have slid back. There's no question. Some patients, after the 4 weeks, within a week or so, they basically have reduced, not only back to where they started, but have slid down. Some patients who have purchased their own concentrators have continued to use it. And I have some patients that have been using it daily now for probably 6 months because it's the only way that they can get through the week. So I don't really have a firm answer. As I said, we have a lot of experience going back as a diagnostic test for over 20 years, but we only have a few years of use of the rebreather. Some patients actually at the end of the 4 weeks, they improved at whatever level they got to, they've maintained it, as Tom has.
Right. And then Alex, to follow up on that, what is the next step towards getting the rebreather ready for patients to actually get it prescribed? Or what would you recommend for someone who's on the call who's going, I want to participate?
All right. So as I indicated, it's been sold in the United States for over 20 years, both the rebreathing component and the Hi-Ox by itself without the rebreathing tube. So everything is FDA listed, meaning that any physician can write a prescription for the Hi-Ox and the rebreather and write a prescription for an oxygen concentrator. So that's the only caveat. It's available. So there are a few physicians in the U.S. who are aware of this, who are writing prescriptions for patients for the rebreather and the treatment. Physicians probably don't know about it because it's relatively new and located within a small group of people who are interested in long COVID. but we haven't had any physician given, we have some material that we can send out to the patient can give to their physician that will pretty much answer their questions. Again, they're only writing prescription for oxygen 2 liters per minute with a sequential rebreathing mask. So it's not something that's foreign to them as far as writing prescriptions for oxygen for patients with long COVID. It should be a relatively easy thing to get them to give you a prescription for it.
Megan, this question's for you. What supplements, diets, lifestyle changes show the most promise? And are there any supplements or other interventions that have been found to boost blood circulation and oxygen delivery for people who can't access this device?
As I had mentioned earlier, in terms of overall promise in the supplement field, probiotics have been the only ones, as far as I'm aware, that have really had, stood up to rigid clinical trial. I know a lot of people also take coenzyme Q10, and this is commonly recommended for mitochondrial or suspected mitochondrial deficiencies, because there's not really a good test for that either. So those are two kind of basic ones to try. Supplements that would boost blood flow, I'm not aware of any specifically. For people with microclots in long COVID, there's a natto-sera combo. It's a natto kinase and serapeptidase, and they can, there's some evidence that can reduce microclots, and that is over the counter in the supplement world, and reducing microclots might then help with endothelial dysfunction and blood flow abnormalities, but that's kind of speculative at this point. I know Alex has a lot more hard data that he showed in terms of how the rebreather does impact cerebral blood flow. But those are some, that do have at least some hard evidence behind them as supplements that might be worth trialing.
Okay,
But of course, I with the disclaimer, I'm not a clinician, and any supplement use, any medication use really needs to be discussed with your care provider. That's just general information in terms of what's in the literature at this point.
Okay, I'm just going to take 2 more questions, and then we will wrap and try to get the rest of them after the fact. So the next question for Alex, has the device been studied in pediatric patients?
So, but not for pediatric long COVID. So there's been a group that's been probably now maybe 4 or 5 years in Pennsylvania using the Hi-OxSR, slightly different rebreathing bag, but the Hi-OxSR for autism, children with autism. So to, again, increase cerebral blood flow, reduce inflammation. So they've been doing that for a couple of years now. So it has been used in pediatrics. Currently, we don't really have a pediatric mask, although if the demand is there, we have a few pediatric masks, but the majority of our masks are for adults, but as we use in pediatrics. I did also, one of the questions, I might just answer this question. So the Hi-OxSR, it's something we designed. So the only place that you can get it is from us. They're $25 for the circuit, plus it cost me $15 to ship it USPS, so it's $40. We don't sell oxygen concentrators or rent them. We have companies that we've worked with that can do rental, and they're about $300 a month, but it includes shipping. Or there are available non-FDA registered concentrators you can buy on Amazon or on the web, where you can buy them for around $300. They're not FDA certified, so the quality is not guaranteed to be as good as an FDA certified concentrator, but they are available, and you can buy them for $300, and you have them for as long as you need them. And some people have used them.
My last question that we'll answer today, since we're over our time a bit, is for Tom. What advice would you give, or what would you say to a patient that's kind of in your position before you started using the rebreather treatment?
Well, again, I am one of those, as Alex said, not it doesn't work for everyone, but boy, I would approach it with confidence and knowledge of the initial sense of lack of oxygen. Don't forget and to have faith in that pulse ox and relax with it. I don't think there's any preparation needed. You have the long purple tube running down your feet can look a little scary. Don't be put off. My wife happens to be an RN, which helped with my confidence. So just approach it with confidence that it's a good thing, and that after a couple of days, the initial session, the feeling of discomfort of not getting enough air is simply not true. As Alex explained, it's that CO2 trigger you're feeling, but it's the fact that you are getting plenty of oxygen as validated by the pulse ox. So relax, don't don't and just take deep, long breaths, and it'll work for me great. So relax into it and give it a few days.
Thank you all so much for joining us today. Again, we'll answer more questions in our newsletter, so make sure you're signed up for that. And make sure to snap a picture of the screen if you want to save that for later. And we'll be in touch with a survey so that you can let us know what you thought today. Thank you so much.